Thanks for joining me. I wanted to just spend a few minutes walking through some sample outpatient reporting that your team could have access to from an online digital delivery standpoint. We at HSG push all of our digital delivery of reporting through Tableau online. Your organization has the ability to simply log in as I'm doing here. You would have a lot fewer views when you get into the specifics of the actual dashboard options, but I'll walk through a quick sample for what we define as our outpatient market share from a sample client standpoint, where we have the ability to first, the data that's feeding into it using physician ambulatory claims data with variable market coverage, both from a commercial Medicare Advantage coverage standpoint, but then 100% of fee-for-service Medicare, ideally trending all of that data over time, where we have the ability to start by understanding what is our overall market share look like within a certain geography. So for this client sample, maybe we have a 15-20 county region, as you may see here on the bottom right. We're capturing 12% in the specific county in Ohio, down to less than 1% in Pike County, Kentucky for the sample we're looking at here. You can then start to understand and see that there were over 5 million patients that received outpatient services in that 2019 timeframe. We captured 662,000 of those individuals through our organization. You then would have the ability to see what are those top entities. Maybe you want to get more specific and say we care more about just our primary service area. So getting in and being able to see, all right, let's hone in a little bit more, look at just that primary service area. Once now we see there's about 2.5 million people in that service area that received services. We captured about 23% of that volume in 2019, up to almost 26% in 2021. We could then get into specifics of maybe we just care about our cardiovascular service line, where we see that our percentage shares increased by almost 9% over that same time period within our primary service area. We won't get into the location trend dashboard, but that gets into look at these same locations, how are they trending over time? Be able to see from maybe a county perspective, within all of those separate counties, once again, how are we performing similar drop downs within our service area definitions, or specifically within our cardiovascular service line. We can see within each of these counties, are we trending positively or negatively? What does that look like? And then maybe we want to get even more specific and say within a subservice line within cardiovascular, maybe we'll use diagnostic cath for the sample, be able to say, how are we performing in diagnostic caths? What's the number of patients receiving that service, and how is that trending positively or negatively as well? Being able to get into a service line dashboard. So now this would be more of a large picture point of view for, as you can see, roughly 30 plus service line definitions included here. Being able to see what that looks like, how are we trending kind of that overall system level dashboard from an outpatient ambulatory perspective, to be able to track and understand what's the relative patient lives and our capture of which, and how's that trending over time. Being able to get into a subservice line dashboard. So now, once again, looking at our primary service area for cardiovascular services. These are the subservice line categories we had options for to look at before. How are those, once again, trending positively or negatively, and relative patient volume supporting that, and being able to, once again, be able to get very specific to individual counties and or service areas based on your geographic needs. The last piece focuses less on the actual procedures, but who's providing those services. So to those patient populations, so you can see this is based on the operating or rendering specialist for every provider that's providing outpatient services to patients in our markets, to be able to see there are tons and tons of options that are available to your organization based on who's actually providing services in your market. We'll use cardiovascular disease general cardiologists for this sample here, where you can then start to say, for just those cardiovascular disease providers, who are the top entities they're associated with? How is that volume trending positively or negatively over time? And then at the bottom half of this table, being able to say, who are those actual providers, and what do their relative patient volumes and their capture of those lives within the market, how is that trending? If you have additional questions you'd like to reach out to me for, please contact me directly, DJ Sullivan, HSG Advisors. Be happy to talk to this in more detail, but really hope that you could see some potential value as this could impact your organization. Thanks, and talk soon. Bye.